clearly if one drug's very expensive, then 2 drugs are twice as expensive and 3 drugs are 3 times as expensive. But the hope would be that by finding the right combination of drugs together, we can get patients onto drugs, get the disease back into a deep enough remission, we could stop the disease, the treatment again. So you'd have the idea that even though you'd have a more expensive 6-period or 8-month period, whatever, defined drug time, you'd get the patients back off the. Is that where you see the field going the way I do?
Absolutely. I think there's several sorts of developments here. As you said, further developments, new compounds targeting the same targets are coming down the road, leading to some sort of competition also with regard to the pricing and the landscape of treatments available. And then, as you say, the combination may indeed lead to finite treatment durations, because you can put the disease into a remission, relieve the patient from his symptoms, and potentially looking forward, I mean, looking at the single agent activity of these compounds, when we combine 1, 2, 3, maybe however many together, I mean, for the first time, possibly there is potentially the hope for even cure of the disease.
So you are in favour of the sorts of trials where you put these drugs in combination, follow minimal residual disease, and look for minimal residual disease eradication as a potential indication for stopping therapy? Or do you think these types of novel agents have made minimal residual disease monitoring obsolete?
Well, I mean, this is an interesting and controversial question. I mean, we know data with ibrutinib, for instance, that the patients who have a longer lymphocytosis in their blood indeed have better outcome. So if you have prolonged lymphocytosis, obviously you are not MRD negative, yet you have better outcome. Now, that principle may revert again when we really combine and try to achieve quickly achieve deep responses. I think yet again the question is still open whether sequencing, smart sequencing, so one after the other of these agents provides in the long term better outcome, or a combination of them all together. But that is certainly a question that we currently at many sites in the world address in clinical trials, if combinations can really lead to finite treatment duration, deep responses, potentially even cure.